Effeminate?
Not just looking good, but not taking too much care of it.
Right. Okay. So it's not
That
looking
sounds
like you try too hard.
Yeah, that sounds a bit sexist because I'm not saying that women should.
Yeah.
But many women do, and that's not seen as a problem.
Yeah. Well, lots of women that I've spoken to, it's a fairly consistent view that they like men to have a few lines. What do you think about the concept that, men should have wrinkles and that having a completely frozen face for a man, and I guess this is some of the, might be considered like unfair that it's acceptable or, it's not unattractive. And I'm not saying women with wrinkles are unattractive. It's not what I'm saying. I'm saying that, women tend to want to be wrinkle-free.
Yes.
Whereas men tend to, well, from my perspective, I want to reduce the movement, but I still don't mind having a few lines, especially around the eyes.
That's exactly that's my take on it.
Yeah, but why though? I mean, why is it that it's acceptable for men to have more movement and lines?
I think
and not
even
for
women would find a man with a little bit of, I don't know his word, masculinity, but a little bit of edge, rugged, whatever you want to call it, that is attractive to them.
Right.
And everyone's got different tastes, but most women don't want a man who's so particular about his looks that it becomes distracting.
That he's prettier than her or spends more time looking in the mirror.
Yeah, it wants to come across as
effeminate?
Not just looking good, but not taking too much care of it.
Right, okay. So it's not looking like you try too hard.
Yeah, that sounds a bit sexist because, I'm not saying that women should.
Yeah.
But many women do, and that's not seen as a problem.
Yeah, well, lots of women that I've spoken to, it's a fairly consistent view that they like men to have a few lines.
Yeah.
And wrinkles.
Yeah, look, my approach to myself, I said it myself, I don't mind a lower dose and a bit of movement, and especially for the crow's feet, is, when a guy smiles and there's a couple of lines or a bit of movement, I think it's attractive.
Yeah.
It's that glint in the eye.
Yeah.
It doesn't look feminized.
Yeah.
And it has less of an effect on the position of the brow.
Yeah, right.
So in fact, even my pattern will be different for a man. So I'll tend to do the standard, 3 points just to calm things down, but I'm not trying to do a brow lift.
Yeah.
Whereas for a woman, I'm a little bit more particular about actually trying to raise the brow.
Right.
So, it's not even just dose, it's where the Botox goes or the toxin goes.
And what about sort of regularity? I mean, I tend to do mine about once a year, or when someone says to me, "Hey, that
was me when I used to work with you." I say, "Hey, get on the bed. We're doing it today."
Yeah, this is an emergency. This is a cosmetic. This is an aesthetic emergency. I can't let you be seen in public like this. But I mean, how often? I mean, what do you think is a good time for between treatments for men?
Just looking at the pharmacokinetics, we know that it will last 3 or 4 months on average.
Yeah.
So, depending on how fussy the patient is and what they need, then sure, you can stretch it out if you want to. But I like to get people in 3 times a year.
Yeah.
Just to touch base with them. I don't have to go heavy on the dose.
Yeah.
But I can, look at their aesthetic, talk about their skin, look at their volume, and just catch up with people.
Yeah.
Thanks so much for watching the podcast clip. You can listen to the whole audio episode of the podcast on your favorite podcast app, on Apple Podcasts or Spotify. And please also leave us a review on the podcast app.
If you like what we do, please smash the like button, consider subscribing to the channel, and don't forget to hit the bell icon so that you get notified when we release new content.